Hi, I'm Tom Lathan. Welcome to another edition of Community Highlights Online, a look at the programs, people, and services of Sunnyside Community Hospital and Clinics. This is part 2 of our series with diabetes educator Cathy Fierro. Today we'll learn from Cathy there are 2 different types of diabetes, and this one's easy if it's on the final exam, type 1 and type 2.
About 5 to 10% of all diabetics are type 1. Type 2 is the most common. Used to be called adult onset diabetes, but again, you can get diabetes, type 2 diabetes, at any age. My youngest type 2 client's been 10 years old. At first, I just invite them to come talk to me. And I need to make them feel comfortable with me. And if the only thing that I accomplish is just a comfort level with me with that first meeting, then that's good enough. When I ask people, what is diabetes? What do you think diabetes is? Most of the time they give me the exact same answer. It's too much sugar in my blood. Well, that's a consequence of diabetes.
We all know doctors and nurses are pretty smart folks and like to use some big words sometimes, but Cathy explains the process of diabetes, comparing it to putting gas in your car. Cars need gas to function. Our bodies need energy. The energy comes from the carbohydrates we eat that enter the cells as we process them.
From our head to our toes, we're a mass of cells. If we look under the microscope, those cells are going to look different depending on whether it's a muscle cell, a brain cell, a bone cell. But they all require one thing. They require energy. And like the car, you just don't unscrew the gas cap and put the energy in. So for us, we have to put the energy in the cell, and it's a little bit complicated. But I make it very simple by just saying that if I were to eat carbohydrates, it starts to actually turn to sugar in your mouth before you even swallow it. Most of it transfers into your bloodstream as it leaves the stomach. So now in your bloodstream, you have the energy that you need. You have sugar in your bloodstream. They need to find their way into the cell. That process is simply just a signal sent to your pancreas, which is a small organ behind your stomach. One of its functions is to make insulin. So when that signal is sent and you start producing insulin, you now have sugar and insulin in your bloodstream. That insulin is going to attach to the outside of the cell. When it attaches to the outside of the cell, it acts like a key. And the cell opens and the sugar goes in. So now you have the energy that you need to function, to think, to move, to breathe. You have your energy.
If you don't have diabetes, that refueling works pretty well most of the time. If you have type 1 diabetes, you will have to have insulin to help your body process food into energy. If you have type 2 diabetes, it's a slightly different story.
Type 2 diabetes, the most common type, 90-95% of the population, something different happens. We would eat the spaghetti, it would turn to sugar. Move into the bloodstream, again the same signal sent to the pancreas that says, hey, we need insulin. With diabetes, type 2 diabetes, you produce more and more insulin trying to open that cell, more and more insulin. Very little of that energy gets into the cell. So if we eat carbohydrates, after we eat, very often we feel very tired, very sleepy, very cranky. Blood sugars get high enough. We could get very thirsty. We could have a blurry vision, start having problems urinating too much, getting up a couple times during the night to go to the bathroom. I've had clients that literally have drank gallons of water a day before they were diagnosed.
On part 3 of this series, Cathy will explain the prevalence of diabetes in the lower Yakima Valley and look at why people test their blood sugar. We hope you enjoy this series, and we'll keep clicking back here for more information on health education from Sunnyside Community Hospital.